Hello everybody, I'm a pharmacist. I'm going to try to talk to you a little bit about smoking cessation, and there's nothing magic on this presentation, so I'll start off with a disclosure. I have no invested interest in this PowerPoint, so I'm not affiliated with any manufacturer or pharmaceuticals. I'm not trying to sell you any product. I'll just give you a little bit. So I'm not getting paid. I'm not trying to sell you any product. My objective is to give you a little bit of background about tobacco dependency and what we use over-the-counter prescription drug to help you quit. If you care, a little bit of background, 500,000 Americans dies every year because of the smoking tobacco products. Meantime, we have the tobacco industry pays about $1 million every day, so about $8.4 billion almost a year to make sure that you hooked. And on the other hand, you have to have a state healthcare system pays about $289 billion to fix that damage. No surprise, most of the people who smoke tobacco, they know it's bad for them. They know about the health consequences, and they need to quit. So the statistics shows about 68% of the smokers really wanted to quit. Unfortunately, about 10% success rate from the first attempt. Keep in mind, these statistics are not accurate. Not everybody included in the survey. Not everybody answered the survey. So the numbers could be a little higher than these numbers. Medicaid people smoke more than non-Medicaid people or regular population. Still, nicotine replacement therapy is first line treatment. I know a lot of people out there, you know what, this is garbage, none of that work. I quit cold turkey and all that. Well, good and well for them, but like again, I'm a pharmacist, so I gotta have to talk about these kind of stuff. Okay, if you look throughout the map of the United States, you know, obviously the darker the color, the higher incidence of the smoking um, tobacco cigarettes between the residents. So West Virginia take the lead, 28%, and then Utah is the lowest among all the states in the country. See the color is very bright. All right, why West Virginia is too high? Is too high because it's cheap. The tobacco cheap. So yes, the statistic shows, or the actual facts shows that higher the prices, less people will smoke. Cheaper the prices, more people will smoke. That's happening in West Virginia. Utah, not only because it's expensive, or not necessarily expensive, but the majority of the Utah residents are Mormons. They don't smoke, they don't drink coffee, don't drink caffeine. A lot of restriction with their religion. So that way, the youth have been, this is not the 2017, 2013, 2014, but it's been like that. Youth have been the lowest state as far as what's in the cigarettes, everything, all the garbage in the cigarettes. You won't believe what's in it. You search the website, thousands of chemicals is in the cigarettes. That means that thousands of cigarettes are in the cigarettes. 600 ingredient. When you burn it, turn to 7,000 chemicals. 69 of them are identified to be bad for you, or carcinogenic, or poisonous. I'm not going to sit here and talk about 69 chemicals, but here's a few. Acetone, that's in nail polish. Acetic acid, it's in hair dye. Ammonia, that's in the bathroom cleaning stuff. Arsenic, that's toxic. Not only red poison, it's a human poison too. Carbon monoxide that comes out of the car. Like imagine if you open your mouth right on the opening of the exhaust and inhaling that carbon monoxide and having really smoke cigarette. Formaldehyde, you know, that's for dead body. And methanol, that's the rocket fuel. Anyway, so where are this chemical go everywhere? It goes everywhere in your organ. I can spend like half an hour talking about the damage that caused, but this picture should, you know, suffices um, the bad side effects from the smoking cigarettes. Coronary disease, peripheral heart, um, peripheral hypertension, AAA, the aortic aneurysm, stroke, angina, and then it goes to your lung, bronchitis, pneumonia, TB for that matter. And also some type of cancer are linked with smoking, which are oropharynx, larynx, esophagus, liver, and so forth. Here's the thing. It also affects your reproductive system. So if a female smokes during pregnancy, you will get a preterm labor, you get premature um, babies, you get low weight birth. And when they asked the CEO about the CEO of Philip Morris in the 70s, Mr. Coleman, they told him, "What do you think of pregnant women who smoke?" He said, "That's perfectly fine. There's no damage." But then the reporter told him, "Well, the study shows preterm premature babies." He said, "Well, some women prefer smaller babies, like flagless babies." Anyway, he was trying to say that smaller baby is okay, but it's not only small; they're non-healthy. Um, Cardiovascular. Okay, I don't have to go through a study, but here's a study that tells you that if you smoke, you're damaging your cardiovascular system. How's that? It's a huge study, 52 countries, thousands of people were followed to see what is the effect of smoking 20 cigarettes, average 20 cigarettes per day. They found you have 3 to 6 times higher incidence to get an MI, which is myocardial infarction, which is your heart stop. Not enough oxygen, not enough um, energy for the heart to work. So you get myocardial infarction when you smoke. You have 6 times higher incident rate of myocardial infarction if you smoke 20 cigarettes per day. Surprisingly, if you only smoke 5 cigarettes per day, you're still a high risk of getting cardiovascular disease. The problem is some people still smoke despite the fact that they have cardiovascular disease. Well, they have an incident risk of sudden death. When it comes to your lung, of course, the notorious COPD, chronic obstructive pulmonary disease, is huge. Smoking is a risk factor for that. All right. Now, some people say, well, the damage is already done, so there's no reason for me to stop smoking. And actually, there is 3 reasons for you to stop smoking. 1, you're going to stop further damage of the lung. 2, you're going to stop disease progression. 3, you're going to decrease the risk of hospitalization and mortality. So yes, you're still going to need to think about quitting smoking or seriously about quitting smoking. Okay, many smokers, no surprise, they keep coughing sputum and phlegm, all this gross stuff. So within the first year for quitting smoking, all that will be cleared, and I have seen that actually. One of the most important uh, treatment for chronic obstructive pulmonary disease or COPD is what? Is to stop smoking. So yeah, there's a lot of drugs out there like Sprelieve, Incruse, all kind of inhaler, high dosage steroids. But check this out. The degree of the improvement that you will notice when you stop smoking far better than high dose of anti-inflammatory drug like a prednisone 40 milligram once a day for 2 weeks. So you surpasses that by quitting smoking. Peptic ulcer, people who smoke, most of them will have this GERD, reflux, acid reflux, and so forth and so on. And here's a study that proves that these people who smoke cigarettes, they have twice as much risk of their incidence of getting peptic ulcer. Not only that, but some studies for unclear mechanism shows that if you smoke and you take the drug that treats peptic ulcer, so you smoke, you get peptic ulcer or GERD, now you take the medication. But guess what? If you continue to smoke, the medication is not going to work. How exactly that work? How exactly that happen? That's a different discussion, different presentation. But just for your information, the 2 classes of medications that we use to treat peptic ulcer don't work as well. So, nicotine, what's the deal? Is it the nicotine? Is it the hands? Is it the gesture? Is it the puffing? Is it the smoke? What is the addiction? What makes me keep going to smoke? It's all that. Some people say, well, it's a social thing. I go out, I smoke. I'm at home, nothing to do. Let's go grab a cigarette. Whatever the hell it is. But if we're talking pharmacology, it's dopamine smoke, nicotine binds to cholinergic receptor or nicotinic cholinergic receptor, the alpha 4 beta 2 in the brain, release dopamine. You get the dopamine, you're happy. All right. Now you get all the receptors saturated, so you don't want to smoke no more. So it passes a few hours, or you go to bed, you get up in the morning, this receptor becomes sensitive again and ready for the nicotine, and that's when you feel a craving. You get the first cigarette. Okay, here's a fact: 4 of the Marlboro men they died due to smoke-related disease. So they heart modeling from Marlboro and killed them. We're not going to talk about all the people that were modeling from Marlboro, but here's a prime example. Wayne McLaren, he died in 1992, age 55, after 25 years of smoking. He started modeling, and he ended up, his life was an anti-smoking campaign. And here's some of his words: "I have spent the last month of my life in an incubator, and I'm telling you, it's not worth it." He further said, "Take care of the children. Tobacco will kill you. I'm a living proof of that." So where to start? 5 A's. Hell's 5 A's. This is just an easy, quick counseling point. So ask the patient, "Do you smoke?" How many? And by the way, when I say smoke, I mean tobacco, which I'm not gonna keep saying smoking, tobacco, or cigarettes, whatever. Smoke. So smoke. It's not smoking marijuana. It's not smoking heroin. It's just smoking cigarettes. So my topic is about smoking tobacco. So ask about smoking, and they said yes, we smoke. Then advise, you need to quit smoking, and then assess. Well, are you ready to quit? And then if they said yes, then assist by offering all kind of help, and then arrange follow-up. Follow-up is very, 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 very important. And now 5R, what does that mean? Same thing. It's an easy, quick point. Remember, it's easy, quick way to remember how to cancel the patient. That's if they decided, or if they say we're not ready, then you should be ready. Why? Because it's relevant. Because every patient has a reason that you will tell him you need to stop. You have kids at home. You don't have money. You're trying to save money. Whatever it is, it's relevant. You're sick. You go to hospital a lot. You have pneumonia. You cough. All right. So, and then the risks. What are the risks? And then you can just pull that slide so you have this anatomy of the body, organs being damaged because of smoking. Rewards, what type of benefits that I'm going to get when I stop smoking, and there are plenty. You can read it here yourself. Roadblocks, what's stopping you from, quitting, and then you repeat that every time you do it. And here's a good picture that was from a government website, I think CDC or something like that. So I didn't steal it from somebody. I get it from a government website, which we should use because we pay taxes for that anyway. So you stop smoking, it's an investment. It's an ongoing investment. You're always gaining benefit from the first day you stop smoking until the last day, until whatever. So in the first 20 minutes, your blood pressure and heart rate will get normal level. 12 hours later, carbon monoxide will drop. 3 months, your circulation improve. 9 months, you breathe better. 1 year, that's when you're gonna start to have the, pulmonary and coronary heart disease in shape, and your risk will drop in half. The 5 and 10 years, it's all about cancer. Your cancer risk for developing cancer, where will drop to the half or even be similar to the non-smoker. This is a chart, if you will, or a questionnaire for the patient to fill out, just to have an idea how dependent that person on tobacco. So you can read through it, like how soon after you wake up do you smoke. If he said that within the first few minutes, then you score 3. If he says, oh no, it's an hour later, which is highly unlikely, then you score 0, and so forth. So the highest is 10. So if you score anywhere between 7 to 10, that's a very high dependent. 4 to 6 moderate, and less than 4. How's it going to help me? It will help you to decide how we're going to treat you, or not treat you, but how we're going to plan for you for your smoking cessation. So like I said, nicotine replacement therapy is still number 1. Why? Because study shows they help, they benefit. Some people don't want to use them. That's fine. I don't care what you do, as long as you can manage to quit smoking, then that's good. So you can use combination therapy. We're going to talk more about that in detail. So what are the products? Some of them are over the counter, some of them are prescription. I'm going to talk about most of the product, but I'm not going to talk about every single product out there. Non-prescription patch, nicotine lozenges, patch, gum lozenges. The other product that needs a prescription is nasal spray, inhaler, or bupropion, or Zantac, or Zyban. And then you have Chantix, but I didn't include that in there. I'm not a big fan of it. Um, the treatment is not one size fits all. So some people will prefer gum, some people can have the gum, some people will like the patches, some people hate the patches. So what is the first line? Surprisingly, FDA did not put one of these products as a first line. So you can say, well, the patch is the first line. You're going to have to start with patches. No, all these products are first line. So whatever fits you is your first line. Um, I made this formulary just for myself, like what to use and what to start with. I figured that the patches and the gum will be my first line to offer to the patient, unless he or she used it in the past and it didn't work for them. There is no sense of me telling them try it again. But if they tried it in the past and they have some success, but they just relapse for any reason, they lost a family member or whatever, then I can always recommend it if they work for them. If there's no contraindication, the patient is willing to try it, then that's what it is. And it's not, you see like $100, 150, whatever, but still less expensive than continuing to buy cigarettes and less expensive than other products. And it's very, very cost effective. How did I know that? Well, look at this. Studies shows that if you use the patch and the gum, you have odds ratio of quitting smoking 3.6. What is the odds ratio? Oh, well, that's another presentation too. You can look it up, but the odds ratio is the ratio of the odds of quitting smoking when I give you the patch and the gum, comparing to the people who are trying to quit smoking without patch and the gum. The ratio is 3.6, so you are 3 times highly likely that you're going to quit smoking if you use these uh, patches and the gum. And the success rate is 36.5. That's a very, very decent number, like almost third, not more than third, of the people who uses these products will quit smoking. Some product out there in the market has a success rate of like 12%, and we still selling it. So if you have 36%, that's pretty decent number. If you are just curious about, okay, if the patches and the gum give you an odds ratio of 3.6, so what's the odds ratio of Chantix by itself? Or what's the odds ratio of nicotine by itself? Or what's the odds ratio of any monotherapy? Or what's the odds ratio or the success rate for any other combination therapy? That's right there. You can check this out. The numbers are here, and it tells you. But like I said, I picked the first one of the combination therapy because it has a very decent numbers, and that tells you what's the odds ratio. Okay, so I decided to start patches. If you smoke more than 10 cigarettes per day, which you most likely are, because most of the people do smoke that much, then we're going to start you on 21 milligram patches, 21 milligram for 6 weeks, and then you taper down to 14 for 2 weeks and 7 for 2 weeks. These are from the guideline. I just didn't pull that out of my pocket. It's in the guidelines, and you can look that up too. Is that like a Bible? Like I have to do that? No. You can do 21 milligram for 4 weeks, and then 14 milligram for 2 weeks, and then for 2 weeks. You're the judge. You made the call. If you're ready to taper down, taper down. But if you do smoke less than 10 cigarettes per day, that's when you start with the 14 and you work your way down. These are some side effects. It's very mild. If you make sure you rotate the sides. If you get irritation, pick up 1% hydrocortisone over the counter and put it on a rash. It'll go away. But like I said, most likely you're not going to have any problem with it. Some people have vivid dream or insomnia. Take it off at night. Don't sleep with it. And then you're looking at about $280 for 24 weeks. That's 6 months. If you're gonna spend almost $300 for 6 months to quit smoking, it's worth it. And that's, you know what, 6 months is really, we're pushing it. Like the studies show there is no benefit beyond 6 months, and a lot of people will manage to quit smoking way less than the first 6 months. Like after 3 months with nicotine replacement therapy, they were able. So you have to spend $150 and $200 before you quit. Okay, if you decide to do the gum, there's two ways. So you can have the patches and you add the gum for breakthrough craving. So you have the patches on and you still want to smoke. What do? You grab a cigarette? No, you grab a piece of gum. Which one, 2 or 4? Because they make both. Well, if you have the patches on, then you get the 2 milligram. And then you only use it as you need it. And you're not going to use that many. You're probably going to use 3 or 4 pieces of gum during the day. But if you're going to use the gum as a monotherapy, that's a different story. So you can start with the 4 milligram. If you are highly dependent, how do I know if I'm highly dependent? You go back to that chart. Or if you smoke more than a pack a day. There is very, very, very important consultation here, or very important piece of information that I have to share with you. If you decided to use the gum, you have to do the chew and park technique. So you chew, you get the flavor, the tingling sensation, then you stop. You park that piece of gum between your gum and cheek. And then you wait a couple minutes, you do it again, and you keep repeating it for like another half hour until all the flavor is gone, and that's when it's worthless. So the chew and park technique is very important because it gives a chance to your oral mucosa to absorb that nicotine, to go to your blood level, to give you that optimal nicotine level in your blood. But if you're just going to chew it so fast and you swallow it, then you're getting all the nicotine in the gut, so you're not getting that much in your blood, so you're not getting the benefit of, you know, the nicotine replacement therapy. And not only that, but you'll get upset stomach, and you get some nausea, and you get all kind of GI problems. And you can read through that, but just make sure you chew and park to give a chance for the drug to work, or the gum to do its job. Same thing with the lozenges. About the maximum dose, we're looking at 20 per day. So you use one every 2 hours. But here's the thing: if you're gonna use the lozenges, there is no chewing. It's just gonna slowly dissolve in your mouth. Okay, and make sure don't drink within the 15 minutes. Don't drink with when you have that gum or 15 minutes later, because if you drink or eat, you're gonna make you're gonna increase the pH. So and that can interfere with the absorption of the nicotine. Here's my favorite drug, bupropion or the Zyban. I like this drug because it's a good drug. So it was discovered or made or invented by Dr. Maida in 1969. Then later on, it was approved by FDA in 1985, and then a year later, it was taken out of the market. Why? So they get so excited. The drug is good. It works. Okay, this drug is for depression. Okay, stress inverted with depression. Why they have to invent that drug for depression? Because it's a little bit of a side story, you know, trying to be distracted or anything like that. But it was invented by Dr. Mehta. He was Indian doctor, born in India, I think 1929, moved to the United States in 1947. He worked for one of the big pharmaceuticals, and then he came up with this drug. The drug was great. Remember, at the time there was Prozac. Well, Prozac has a lot of, Prozac does give you the sexual dysfunction and put weight on you and stuff. So some undesirable side effects. They came up with this drug. This drug was really good. It was great. So it took care of the weight. Actually, people lose weight when they take it, and there's no sexual dysfunction whatsoever. As a matter of fact, it increases libido. So it was magic. But it also has one problem. It has one problem: seizure. So they noticed that people seize when they take that drug. So what happened next? Take it out of the market. 1986, take it out of the market. The drug, the formula is very precious. It's very good. They don't want to just kill it. So they thought about how to improve it. Two things to improve the drug. One, we're going to knock down or decrease the maximum dose from 600 to 300. So that way we're going to avoid the seizure. Why? Because the seizure is dose related. So the more the drug you take, the more risk of seizing you'll have. So cut the dose, cut the risk. The other brilliant thing that they did, I think in 1996, is the sustained release format. So the drug break down little by little, and not immediate release. So when you do that, you give yourself a little bit of a drug over a longer time. So that's definitely gonna reduce the risk of developing seizure. 1997, that's when they decided to use it as Zyban for smoking cessation. Here's the question: hell is the drug that used for depression can help anybody with the smoking? Okay, because go back to that nicotine, works on the receptor, give you dopamine, you're happy because you have dopamine now. That Zyban does the same thing. It's dopamine norepinephrine reuptake inhibitor, and so I kind of mimic that effect that you get from nicotine. So you have some resources says it's a nicotine antagonist, but it's not something that I can say it's 100% accurate. So be careful. You're gonna start with 115 milligram SR, the sustained release, not the immediate release, once a day in the morning. Take it in the morning, not at night, because the insomnia side effects. So you do 150 milligram once a day in the morning with food for 3 days, and then you taper up to 150 milligram twice a day for the next 12 weeks. Two things. If you're gonna do it twice a day, then make sure that last dose is not at bedtime, because it's gonna screw you up. So you don't want to do that. So you take it later in the afternoon. Just make sure there's a good 8 hours between the first dose and the second dose. So keep that in mind, right? Now, you're good, you're happy, you don't want to smoke, the drug's helping you. You need to tell yourself, you need to tape yourself down. And then you're going to go back to once a day and then once every other day and then you stop. Right? So we're going to do that with this drug. Actually, I have people who quit smoking with these products. And some of them I work with, some of them they have I have came across them when they were buying these products. So the main thing was a consultation. The main thing was just education, education, education. Like, what does this drug work? What is going to do to me and stuff like that. So you keep in mind the side effect. Keep in mind the duration, how long I'm going to be using it, and so forth. So I have 60-year-old decided to quit. Um, and it's been a while now. It's been like 2 months since she smoked her last cigarette, and she's better because since the smell is better, and since it is her daughter is a nurse. So there was a problem here that every time that person wanted to smoke, she had to hide from her daughter. She doesn't have to do that anymore because her daughter is so proud of her. So it's kind of it's kind of improved your life. Like I said, it's not one size fits all. Some people have their own reason to quit. Everybody has their own motivation and their own reason for why they want to quit, right? So when they do quit, then they gain all this benefit, right? 55-year-old has a problem with coughing, cough, and a phlegm. So obviously that has improved a lot. Well, some people say, look, I don't cough, I smoke, I don't have any coughing. I don't know, then you probably have other problems, you know what I mean? I have 44-year-old. She was on Chantix. I didn't put her on Chantix, but the doctor did. So I still have to follow up with her. It was great. Works great for her. The only problem with Chantix is it's overrated. People say, "Oh, dream. I have bad dream. I have bad dream. I have all this psychotic problem with the drug." You know what? If you check the website, recently FDA says we're gonna have to improve the labels on the Chantix. We're not gonna have that black box warning, or we're not gonna have that um, vivid dream and psychotic side effect there anymore because it's overrated. Because the data showed after the drug been in the market for so many years, data showed that after all that, it's not that bad. That bad reputation with the Chantix is not that bad as people will explain in it. So that to keep in mind. So if you want to, like I said, same thing. Don't take the last dose of Chantix at bedtime. Make sure you take it with food. Keep yourself hydrated. Take it with plenty of water. You're probably gonna have any side effect. But some people do have bad dream with it. That's their side effect. You can't control that. I actually that patient told me a little bit of a story that she was taking care of her mom, but her mom was sleeping in a different room. So how they communicate is by the walkie or by the baby monitor. You know how you have a baby monitor in one room and you sleep in the other room, and then through that monitoring you can keep an eye on the baby. So she was giving her mom that monitor. So every time her mom, make any noise or wanna call her daughter, she will communicate through the monitor, and that's when the daughter goes to see what's wrong. Okay, so unfortunately, that person lost her mom, and now after taking Shantic, um, she sees in her dream that the monitor goes off, which is sad because she's missing her mom, and now she has to deal with that dream. But not necessarily because of Shantics, but it could be because of anything else. It could be maybe because she do misses her mom, and that she do miss her mom, and that's why she had her dream. But anyway, if your insurance cover, it's a pricey drug. It's about $300. Don't spend $300 if you can get, and $300 for one box. That's only 4 weeks. That's not 6 months. Versus the patches on the gum, you can spend $300 for 6 months, which you're not going to do that because hopefully you're going to be off of it before the 6 months is over. So definitely, if your Shantex is not covered, you can use the patch and the gum as a combination therapy if you are highly dependent on tobacco, or if your insurance covers your Shantex and you do want to give it a shot. But again, be careful of side effects and hopefully okay. All right, guys. Good talking to you all. Good luck, good luck, good luck. I really wish all of you pass to be able to. I wish you the best and be able to quit. And I give you all this information, so now it's on you to quit smoking or share it with other people to help them to get off the smoking. Thank you. Take care.